You know that I'm a 24-year breast cancer survivor, and I am a proud Philadelphian, and I actually lived 2 blocks away from where Rocky ran through. Those of you old enough to remember Rocky. So, you know, this year is the National Breast Cancer Coalition's 20th annual advocacy training conference, now the Advocate Summit. And I know several of you here today were with me at that first conference and have, like me, been at all 20. For nearly a third of you in the room, this is your first time. And that's just one sign that the work we have done continues to gain new support throughout the larger community. I vividly recall my introduction to the National Breast Cancer Coalition. It was 1991, 3 years after my diagnosis of breast cancer at 39. I was a partner in a law firm, mother of a 4-year-old son, and a community volunteer. A small group of women invited organizations from across the country to Washington, D.C. to hear about an idea, a coalition of organizations to focus on political activism, to change the systems of breast cancer, research, access to care, to figure out how we could influence all of the decisions that were made about breast cancer, to become breast cancer activists. There were probably 60 women and 1 man in that room, and a movement was born. The women in that room that day in 1991 were not content with just talking about what needs to be done. They carried that talk into action and launched this amazing resolution that is the National Breast Cancer Coalition. We are proud of what we have accomplished, but true success continues to elude us. Over the last 2 decades, we've lost far too many of our sisters and brothers to this disease. Many of the women who were in that room in 1991 or who helped lead us in the years to follow are no longer here. You know, we stand in the shadow of giants, and that is very true of everyone in this room. Certainly I do. Stand in the shadow of incredible women who started this movement, who kept it alive, and for many, they did so while breast cancer took their lives. They had the courage and the vision to push for an end to breast cancer. Not just more money for research or a new drug or a new way to find cancer. They reached beyond those usual expectations. They had the courage to demand the end of breast cancer. We must always remember and pay tribute to those leaders who are gone. Now, many of you have your own to remember, and I'd like to take a moment to celebrate some of NBCC's. Pam Onder, Pat Barr, whose daughter, Shira Sternberg, was on this stage just moments ago. Remember Kendra McCarthy, Karen Noss, Annette Drummond, Jean Powers, Marcia Pretsky, Jan Ike Swigert, Ronnie Rosenberg, Kathy Zeitz, Becky Morris, Martina Correa, Kathleen Livingston, and Carolina Hinestrosa, and so many more, too many more. We are here, I am here because of them. And the fact that they are not here is just one more piece of painful evidence that while we have come far, we have many more drugs, we have more and better technology, much more awareness, and a list of accomplishments, we haven't ended breast cancer. And it's just not enough. Our revolution must grow. We need to be even more bold. We need to be even more courageous. Picture them standing here with me as I tell you this. In 1991, we set a mission to end breast cancer. And in 2020, we will get there. You know, I worked with these women. These women were not a part of this movement to cure their own breast cancer. It was not about them. They launched and nurtured this movement for their daughters, their granddaughters, their sons, for future generations. And it is for the future generations that 18 months ago, we launched Breast Cancer Deadline 2020, the end of breast cancer by January 2020. And being NBCC, we're not content with simply saying those words or raising awareness of the need for a deadline. We have a plan of action to get there, a blueprint that I will share with you today of what we've accomplished to date, what we plan going forward, and what you must do to help us get there. We started in 2011 with reporting to the public, which we will do every year, about progress in breast cancer and progress on the deadline. We started with a baseline report of where we are in breast cancer so we can measure real progress. Last year at this meeting, I shared with you some of the findings from that baseline. Many of you were very surprised to hear how little we know and how little change there has been in the important outcomes, because we cannot measure success or progress by the number of new drugs or the number of women who get screened or the number of pink ribbons in the world. We cannot define success as achieving what we can do, but by what we must do. What are the outcomes that matter? To NBCC, that's preventing women from getting breast cancer in the first place and preventing deaths from it. As that baseline report made clear, despite years of campaigns to raise awareness, ever-expanding screening programs, increased fundraising efforts, and research, we are nowhere near where we should be in those outcomes. We are far from the end of breast cancer, but we have seen some progress. We've extended life for some women with metastatic disease. Mortality rates have declined, but breast cancer remains the second leading cause of cancer death for women in the United States and the leading cause of cancer death for women globally. In 1991, in the U.S., 119 women died of breast cancer every day. 20 years and billions of private and public research dollars later, that number is 110 every day. That's one death every 14 minutes. This year, nearly 40,000 women and roughly 400 men will die of breast cancer in this country alone, almost 500,000 worldwide. That should not be considered success or even meaningful progress by anyone's standards. And this is an important fact. The incidence of women diagnosed with advanced breast cancer has not changed. Since 1975, rates of diagnosis of truly lethal disease have remained stable since 1975. We've made progress in treatments. We've learned more about the biology of the disease. We know now that not all breast cancers are the same. We have some targeted therapies for different subtypes of breast cancer, but our knowledge of the biology of breast cancer has not been translated into many new therapies to treat it, and we do not have a cure. All of that is the problem. We, all of you, are the solution. We've spent billions of dollars deepening our understanding. We've developed this incredible technology. We've convinced those in power and government that they have a role in our mission. It is now time to harness all of this knowledge, all of these tools. It's time for a new approach and a focus on a goal, not the goal of a new drug or a new way to find cancer. It's not enough. Not yet another congressional resolution to declare support for all of us. The goal needs to be the end of breast cancer because it is time. As I said last year, We have to end our addiction to comfortable, to easy, to good enough. This will require all of us who care to play a role in this campaign, all of us to find the will, the strength, the belief to do what it takes to achieve the end of breast cancer. You know, I'm going to ask you to think for a moment about something Robert Kennedy said. Few men are willing to brave the disapproval of their fellows, the censure of their colleagues, the wrath of their society. Moral courage is a rarer commodity than bravery in battle or great intelligence. Yet it is the one essential, vital quality of those who seek to change a world which yields most painfully to change. My charge to you last year was simple. It's all up to you. You have the power to do this. No one else can. No one else will. You can find the courage, the moral courage to do what is needed. That's why you're here. But it's not just about these 4 days in DC. You have to bring the deadline back to your communities, including virtual communities. And you've begun to do that, as we've seen by the reports you shared from each of your states about your actions during the past year. Now we must build on that momentum. We have a plan for what NBCC, you, can and will do to achieve the deadline. But ultimately, whether we see success really depends on others who are willing to find that courage, put aside fear of failure, focus on the possible, and stand with us to move forward toward that goal. NBCC cannot do it alone. What is our blueprint for success? Well, we can and will point the way. We'll create collaborations, ask the right questions, bring the right people together, formulate and implement plans of action, and identify and push for the policies needed. But success will depend upon those outside NBCC, the leaders in industry, in government, in science, in the advocacy community, all of you to do your part. And remember, this is a global effort. Every part of our plan must be implemented in a global context. And on that global front, our blueprint must make certain that everyone, everywhere, has access to what is needed to end breast cancer. Our plan here is to form committees by continent, expand our international grassroots networks. We will help them conduct political campaigns directed to the European Union, to parliaments in Africa and around the world, to make certain that leaders everywhere embrace, endorse, and act on the deadline. Our blueprint recognizes that the conversation must change everywhere. That has to happen in the public arena, in the media, in politics, and in science. Everyone has to talk about breast cancer differently, and you are vital to making that happen. You are here because breast cancer is an issue you care about. You've made the personal decision to be an advocate and play a role in ending this disease. And the first step to change the conversation in breast cancer is to start where you are, within your support group, your local fundraising walks, runs, other events, on your websites, in your newsletters, everywhere. It all begins with you and the role you play in your local communities. We need to raise awareness there of the need to end breast cancer. In the media, we have begun implementing a strategic communications plan to increase our influence with reporters, editors, and others to ensure that the media reports breast cancer issues in the context of how it moves us closer to the end. Our messaging is all about Breast Cancer Deadline 2020. And again, you play a major role in this part of the blueprint. You must all look for and take advantage of every opportunity to blog, to write letters to the editor, to be on local TV and radio. Be in a free handout newspaper in your community or in major media, you need to connect every discussion to the breast cancer deadline. We know we have to educate the media. Since the launch of the deadline campaign, we've held a project lead for the media. We've met with editors, we're doing desk side briefings, and we will continue and expand these efforts. We can change the conversation in the political arena too. We've certainly shown that we know how to do that. Policymakers should look at every bill, every regulation, every hearing in the context of how it moves us closer, what impact it will have on ending breast cancer, what difference will it make. Conversations on the floor of the House and the Senate, in DC, in the states, even locally, in offices, committees, during elections. If it is about breast cancer, it must be in the context of the deadline. We are helping to change the conversation by getting those in office, elected, appointed, federal, state, local, to put their signatures on a declaration of support for the campaign so we can begin the dialogue with them and hold them to it. We're educating them through congressional forums and by our trained grassroots networks interaction with them. Your influence has power. The science conversation has to change. We must help make that happen. And we are, through our catalytic projects, by bringing science leaders into the campaign, by showing up at all breast cancer scientific meetings to bring the deadline message. We need to lead the research community to ask the right questions in the right way. They must talk about what are the issues that need to be solved to end breast cancer, to stop women from getting it, and to stop women from dying of it. Through education, training, advocacy, and outreach, we are changing the conversation in breast cancer everywhere that conversation is happening, and you need us to help get there. But changing the conversation is not enough. What action do we take? Our blueprint is also a plan to move the scientific community to the deadline by creating new collaborations, identifying the important questions, and designing and implementing solutions. We will continue to change how research is done. Breast cancer research over the decades has produced elegant science and thousands of important research papers, but little that has had a significant impact on patients or those at risk. We hear over and over again from researchers, and we see it ourselves, that the system rewards safe ideas, and it discourages innovation. It discourages innovative, creative ideas that might lead to real breakthroughs in prevention and treatment. Now, we could go on waiting for scientists to figure it out, and we would still be waiting at least another several decades. But NBCC's blueprint takes control. No more focusing on an individual researcher's particular question or publication or institution. We're bringing them together to say, what are the big questions? How can we answer them? Who needs to be part of that? How much will it cost? We've developed a collaborative and rapid research process that will cultivate development of innovative ideas that will ultimately end breast cancer. This is a paradigm shift in the world of breast cancer. We started with the creation of the DoD Breast Cancer Research Program. We trained advocates, gave them a seat at the table so they could influence research, influence the mechanisms that fund research. We made certain funding went to foster collaboration and the inclusion of advocates, that it would support big questions with high impact and innovative, creative approaches. We laid the groundwork over the past decades through the DoD program. Now we must be more directive. NBCC's efforts to engage scientists, clinicians, and breast cancer advocates in the deadline, our blueprint will make certain that they are directed with a single-minded focus on Breast Cancer Deadline 2020, on the work of preventing breast cancer and preventing its spread to stop deaths. What is our blueprint in this arena? To build on what we started with DoD. Well, we began with summits. We brought together diverse stakeholders to help develop plans of action, to begin to prioritize questions, figure out how to get answers. During 2011, we held a strategic summit around primary breast cancer and around preventing metastasis. Tomorrow, you will hear from some of the scientists and advocates who were a part of those summits. We looked at these areas broadly. We did not want to focus on any one approach. We needed a diversity of perspectives to make certain we would focus on meaningful issues. In both areas, we asked, what do we know? What do we need to know? What are the creative approaches? How can different approaches complement one another? And finally, what do we need to do to move forward to achieve progress for women and end breast cancer? Once we have the questions identified, how will we answer them? The substantive work of Breast Cancer Deadline 2020 will be accomplished through a series of catalytic projects known collectively as the Artemis Project. Now, we launched a pilot test of the Artemis Project to develop and implement a 5-year plan for a preventive vaccine. We identified the issues, we formed collaborations around them, we designed the framework for a research plan, we identified areas for seed grants, and we just held the 2nd annual meeting of that project to assess progress in the field and within the project. And we are very happy with how that is moving forward. We've created a new paradigm for research. Now, the summits have brought us to the point where we have identified some other big questions that need to be answered to end breast cancer. And we're moving forward with catalytic projects, like the one I just described for a preventive vaccine, to get those other answers. Some of those areas will be, what is the role of viruses and inflammation in breast cancer initiation, development, and spread? The role of the immune system in preventing breast cancer and metastasis. And a look at, when does it happen? When in a woman's life do the events occur that lead to breast cancer? Let's figure that out so we know when to intervene. And we know so much that we are not applying to breast cancer. What about the information we now have on chemicals, on lifestyle, on already approved drugs that are cheap and relatively non-toxic, yet show a relationship to breast cancer? Perhaps aspirin, diabetes drugs, beta blockers, others. We can continue to study those in silos and talk about them, but NBCC intends to use its influence to make certain we get those answers. We're meeting with leaders in government and academia to support trials to get the evidence. There's a moral imperative to do these trials, and NBCC is taking this on as a priority. But there is more to the blueprint. While we can control the infrastructure we create, the catalytic workshops, the outreach campaigns, what public policy we support, that is not enough. We must also change the infrastructure that exists now within government and elsewhere. As part of our blueprint, we're hosting a catalytic workshop looking at the systems of institutions and interests that catalyze and coalesce around breast cancer today. What is it about them that stand in the way of real progress? Why is it so hard? Why are so many people afraid to try? Many have asked those questions for many years. Well, we're going to answer them. We're bringing together the risk takers, the visionaries, to figure out how research, knowledge, innovation, activism, ethics, politics, and money can be organized in an incredibly nimble, risk-embracing, adaptive, and relentlessly focused on making progress toward Breast Cancer Deadline 2020 goal. We're going to figure out how to do that, and then we're going to make it happen. More and more researchers want to work with us on the deadline. I've heard from scientists who attend our summits, who work on the vaccine project, say how their involvement in this unique approach helps them think differently about their work. They form new collaborations that will get answers more quickly. They're able to learn from others doing similar work. They're learning from other disciplines about different strategies to address the questions. And they recognize that through the work of Breast Cancer Deadline 2020, they're able to participate in something that has been missing in breast cancer research, a true collaboration that rises above individual agendas to focus on the big picture of what is happening and with the focus of ending breast cancer, not a focus on an individual's work or the next publication or grant, but rather a focus on the real goal of saving lives. And how do we get leaders elsewhere involved, in government, in industry, in philanthropy? We've always worked from both directions, from the ground up, our grassroots activists, you, demanding and bringing about change. And we've worked from the top down, convincing our leaders about what must be done to make true progress. But where are our leaders on these issues today? Have they forgotten how to lead, to take risks, to answer a challenge from the people? We must make certain that governments, corporations, leaders from all walks of life make ending this disease a priority. Many of our nations and world leaders in public policy and elsewhere have made public statements of their dedication to ending breast cancer. They've pinned pink ribbons on their lapels. They cut ribbons to open the new breast centers in their communities. Well, now it's time to move them beyond that. It's time to move them to action. It's time for these leaders to play an active role in changing the systems to allow us to truly learn how to end breast cancer by January 2020. We know that the government certainly has a role to play in this mission. What do we want that to be? Our plan includes legislation and education. The Accelerating the End of Breast Cancer Act was introduced to the U.S. House of Representatives in September, and we're working to introduce a companion bill in the Senate. A vital component of our campaign, this law is designed to leverage the nation's past investments in biotechnology, in biology, in ideas and knowledge that can help us end breast cancer but aren't being used that way. This will focus on, again, primary prevention and preventing metastasis. A lean and mean commission is going to be put together to answer these questions. We've seen that a president can play a critical role in ending breast cancer. All of you have begun collecting signatures on the petition, which we will deliver on Inauguration Day in January. Meanwhile, we've also been in contact with the presidential campaigns to secure statements from the candidates with their views on breast cancer, and more specifically, requesting their support for Deadline 2020. And we will report their responses to the public. We've been conducting meetings with leaders of industry to get them involved in the deadline. We're building a global campaign committee of individuals who are leaders in their field and community and committed to the deadline. They will help provide strategic counsel, evaluate strategies, get the resources we need to make this campaign a success. But what about us? What about the advocacy community? We need to change also. What is true for research and healthcare is also true for advocacy. More of the same will not produce different results. All those at risk, all those who care about them, must join this revolutionary activism movement with the goal of ending breast cancer. Those of you who were here last year left with a toolkit, equipped to go back to your communities and help change the conversation. With less than 8 years left in this deadline campaign, it's time to redouble our efforts. We have a plan to get there, and you are a key part of it. It requires the involvement and leadership of all of you. Now, we have long been a leader in educating advocates through activities like this summit, like our acclaimed Project Lead science courses. This year, we're broadening our efforts and adding a significant online component to our training to reach many more women and men who care about this and want to be involved in the Deadline campaign. We will be working with you and your colleagues regionally to develop networks of support and advocacy in your communities. We started in 2011, and we built local networks in Massachusetts, Illinois, and Washington State. But we're not just looking at this on a state-by-state level. We're expanding our efforts with our emerging leaders, both on college campuses and among young adults in general. And our international Project Lead graduates and others across the globe will work with us to mobilize communities worldwide. This campaign, to be successful, must gain the support from a diversity of groups and organizations, not just those focused on breast cancer, but all who care about and understand the importance of this issue. Since the launch of the Deadline campaign, more than 100 organizations have endorsed the campaign, and that number continues to grow. This expanding list of organizations needs to expand even more, and we need you to help make that happen. Is your organization signed on? How many others can you reach out to? You know, many of our member groups focus on extremely important specific issues in breast cancer: young survival, HER2, metastatic disease, triple negative, disparities, and they should. But we must all come together to work on this overarching issue in breast cancer, on the strategy to end breast cancer. You need to be ambassadors for the Deadline. You need to recruit others to join this important movement. You know, by calling for an end to breast cancer by 2020, we're calling for an end to business as usual. We have no desire to increase awareness of breast cancer or continually increase funding for research. Indeed, our foremost goal is to bring about the demise of the National Breast Cancer Coalition by accomplishing our mission. Now, we can achieve our mission to end breast cancer with the right planning, passion, leadership, and funding. At the current rate of progress, it could be centuries before the end of breast cancer. It can happen by January 1, 2020, and it will. I've laid out for you some of the blueprint, our plan of action to achieve that deadline. I've told you that we cannot do it alone, but I assure you that we will do everything possible, everything we can to achieve that goal. Jonas Salk joined as head of virus research lab to find a cure for polio in 1948. The vaccine was announced to the world 7 years later. On May 25, 1961, John F. Kennedy announced the goal of placing a man on the moon. Neil Armstrong set foot on the moon 8 years and 2 months later. The tools, the information, the resources, the wisdom existed to achieve those goals, and they exist now to create and implement a global strategy to end breast cancer. It's been 20 years since NBCC was founded with a mission to end breast cancer. Are we close? Nowhere near close enough. Has there been progress? Yes, of course, but not enough. With your help, we all have the opportunity to make history. It will take all of us working together to change years of incremental progress and inspire a decade of unparalleled achievement. Will it be challenging to meet the deadline? Absolutely. Will it be controversial to try? Oh yes, no question. This will be one of the most difficult things any of us has ever undertaken. But that is how it should be. This requires all of us to play a role in meeting our goal, all of us to find the will, the strength, the belief to do what it takes to achieve the end of breast cancer. Moral courage. Will others disapprove? Yes. Will there be censure for our willingness to push the status quo in entirely new directions? Yes, we've already heard that. Will this work make others rooted in that status quo angry? Oh, yes. Should that stop us? No. Remember, moral courage is the one essential, vital quality needed to change the world of breast cancer, and NBCC advocates have moral courage to spare. Let me borrow and paraphrase another of Robert Kennedy's words as he quoted George Bernard Shaw. Some men see things as they are and ask why. We dream things as they can be and ask why not. We're the dreamers who take those dreams and make them reality. Breast Cancer Deadline 2020. The deadline is a lifeline for all of us who care about those who have it, those at risk, our mothers, our sisters, our daughters, our sons, our friends, that next generation, all of us. The end of breast cancer by January 2020. Breast Cancer Deadline 2020. It's time. Are you with us?